I chose neurology as a specialty over 20 years ago. At the time, when I looked forward to the rest of my career, which I would hope would last 30 or 40 years, I wanted to choose a specialty that I thought was going to have the most advancement. And so far, 20 years into my career, I have been pleasantly surprised that that actually has been the case. We have treatments now for things such as Alzheimer's disease, new treatments for Parkinson's disease, interventions for stroke, many more new anti-epileptic drugs. So for many of the conditions that we treat, there are many options that are available now that were unheard of when I made this decision now 25 years ago. As a patient comes to see us, what we're trying to figure out is, does this patient have a disease of the nervous system, central or peripheral nervous system, or not? And we go through a history where we get as much information as we can with regarding to when the symptoms came on, what they are, a neurologic examination, and then depending on the results of those, then there may be some testing that is necessary, but the goal, the ultimate goal of the entirety of this process is to see if there is anything that we have to offer each and every patient who comes to see us with regards to relief of any symptom that they have. In our practice with 8 neurologists, we have the advantage of having more heads than one when there are issues or symptoms or findings that may not imminently make sense right off the bat. We have neurologists here that have been practicing anywhere between 2 and 40 years, so there is no replacement for the value of long-term knowledge and experience, and we have that in spades here. There are times as we see patients where the success and their ability to return to their previous life is so gratifying and sometimes surprising. Our ultimate goal is to make sure that everyone who comes to see us will have the fullest quality of life, and anything that we can do to aid in that, we will do that. I'm Dr. John Livingstone, and I'm a Riverside neurologist.